funds into the budget.
32 total.
Yeah, so 16 general.
16 general.
Also, the timeline is very aggressive for this, and if it can't be pulled off in time, then what are the other avenues for obtaining those savings?
And what did your research reveal about other states' experiences when they're ramping managed Medicaid up?
Generally speaking, savings are realized in mature systems. So systems that have had several years to operate in a state when the vendors, a managed care organization or some other entity has become practiced at serving the population, at what its needs are, where the cost and utilization patterns are. And conversely, when the population being served learns the managed care system and learns how to appropriately access services. Savings would be to simply limit services, right? I don't think that's what the state is talking about doing. I haven't heard anything that would make me think that that's what they are doing. But to the extent that savings envisioned, so 16 million in general funds are envisioned in savings in the biennium, it's unlikely that, given our experience, our prior experience, and other states' experience, that full savings would materialize within a biennium. And so, if it doesn't, then what's the next option?
If you're not limiting the services, then how are the savings realized on the state level?
I think that's a great question. I think the legislature has lots of options. It's not limited to just the Department of Health and Human Services. They could repeal the tobacco tax cut. I mean, they have lots of things that they could look at. I don't think it necessarily has to come directly from the department. That's really a legislative question, a budget question.
No, I apologize. What I was asking is, within managed Medicaid, if there are savings to be found, but they've made the decision we're not going to cut services, how do you get savings?
Right. You either limit, you either further reduce provider reimbursement, or you limit the number of people who can access particular, I mean, there really is no way around it, right? It's either services or it's reimbursement. Like, those are the two drivers. About many managed care systems in Medicaid programs suggest that savings are rather unpredictable, that one state can get 0.5% of savings and another state can get 20% of savings. A lot of it depends on whether or not they have urban markets, how much managed care organizations have already penetrated their healthcare markets, and the number of people that they're serving. And we have a relatively small population in managed care. I mean, in Medicaid, we have significant rural regions. So, I think there's a real question about.
So I mean, talking about that, I think would be interesting. I mean, you've got questions around that.